Medicare conversion factor, why doctors can't make ends meet. In our video, What is a Relative Value Unit?, we considered relative value units, or RVUs, and how those impact payment to doctors and clinics. We also discussed how RVUs affect doctor compensation calculations, that is, doctor salaries. In July of 2024, Medicare cut its conversion factor, CF, for calendar year 2025 services. So beginning January 1st, doctors and hospitals face yet another cut in pay for patient visits performed. Here's why. In a clinic setting, the money a doctor is paid for a service is based on the current procedural terminology, or CPT code, that he bills. After your visit to a doctor, he documents your chart, selects a diagnosis code, and then chooses a CPT code so he can submit a claim to your insurance company.
The diagnosis code suggests what and why the doctor treated you, and the CPT code shows a level of service provided. The insurance company then pays the doctor, medical practice, or health system based on that CPT code. For instance, if you see a cardiologist for a moderately intense follow-up visit for, let's say, congestive heart failure, your cardiologist might bill a Level 3 recheck, a CPT 99213. The CPT is billed based on the diagnosis and complexity of the office visit. Your doctor then submits that claim to the insurance company for payment. So how is the value of a 99213 calculated by Medicare?
As we've discussed, Medicare utilizes a formula to craft payment rates for each CPT code. The RVU component pieces for work, practice expense, and malpractice expense are multiplied by geographic practice cost indices, or GPCIs, and the sum of these products is then multiplied by the conversion factor to arrive at a geographically adjusted reimbursement rate for a CPT code. The formula looks like this. WRVU times WGPCI plus PERVU times PEGPCI plus MRVU times MGPCI times CF equals Medicare allowable. If you recall from What is a Relative Value Unit, the payment value of a CPT code changes from location to location throughout the United States. Why? Because it's more expensive to see patients in downtown New York City than it is to see patients in Valdosta, Georgia. Via Medicare, the GPCI takes geographic cost differences into account. So how does the conversion factor impact payment? In 2024, Medicare paid doctors about $86 for a 99213 in Valdosta, while it paid $103 for the same visit type in New York City. Remember, that payment difference is based on location and the cost of practice medicine. Now let's assume that Medicare does not change the RVUs or GPCIs for 2025, but follows through on the changes in the CF. As you can see, the New York City and Valdosta doctors will, for the same procedure and work, lose about $3 for 99213 performed in 2025.
In New York City, the payment drops from $103 to about $100, while in Valdosta, the payment is cut from $86 to about $84. This cut was slated for almost all CPT codes for 2025. Now that doesn't seem like a lot of money or a big cut. But if you consider that a 99213 is one of the most frequently used CPT codes in the United States, that lost $3 begins to add up. Also, inflation continues to increase, meaning payment doctors receive for any CPT code will not only be cut, but doctors will be hit with higher costs to run their businesses. Lastly, the CF has been cut a bit more than 10% since 2020.
At Cubed, we wonder how long can this go on? Private practice doctors have been and continue to flock to private equity funds and hospitals to shield themselves from the pain and cost of doing business. This is a very simplistic example, but as with our other videos, paints a directionally accurate picture of care delivery across the United States. Remember, Cube's videos are not meant to answer all questions precisely. There's so many moving parts in care delivery throughout the country. Just remember, some nuance exists geographically. Healthcare really is local. If you have an idea you'd like us to address, please subscribe, like, share, and if you have any questions, email them confidentially to questions@cube.org. Stay tuned for our next educational video.